next speaker is Zainuddin Saleh. He's one of our future doctors. He's a sixth-year student at the Hashemite University of Jordan.
Assalamu alaikum. Today we are going to present our research, long-term use of a protein pump inhibitor and the risk of osteoporosis. My name is Zainuddin Saleh, and this study was conducted in collaboration with my colleague and under supervision Dr. Maisligda and Dr. Mu'taz Massad. At first, where did the idea for this research come from? هسا احنا كطلاب طب السنه السادسه بالجامعه الهاشميه داومنا وبنداوم بمختلف الاقسام والعيادات بمستشفيات الحكوميه ومستشفيات الخدمات. خلال دوامنا لاحظنا الاستخدام المتكرر والاستخدام الكثير لادويه اللي هو البروتين بامب انهبيتور. من هون بلشنا نفكر ونقرا اكثر اللي هو From this point we start reading more and more about the prolonged protein pump inhibitor use. Now we will present three scientific facts. The first one, the normal gastric pH and the stomach, it is about 1 to 3.5. The second fact, that it is the calcium absorption, it is the best about in the pH 4 and below, which means that the calcium absorption, it is the best in the normal gastric pH. So, the third scientific fact, a protein pump inhibitor, it will be significant increase the pH. It will make it 5 and higher. So, from this point, by logic, does the long-term use of a protein pump inhibitor will cause osteoporosis? From this point, we thought, does long-term use of protein pump inhibitor increase the risk of osteoporosis? We do a literature search and a literature review about the topic. We found several studies. Some studies say that there is no association between the prolonged use of a protein pump inhibitor and the risk of osteoporosis. Other studies say that there is a significant association between a long-term protein pump inhibitor use and the risk of osteoporosis. So, we conduct this study to see if there is any association in a Jordanian population. At first, our methodology, it is a retrospective observational study that conducted in two hospitals, Al-Zarqa and Al-Bashir New Governmental Hospital. The total participant in this study was about 695, age 20 to 60 years old. We divided our participants into three main groups. The people who used the protein pump inhibitor for more than 12 months into the PPI group, the people who used the famotidine for more than 12 months into famotidine group, and the non-exposed group that doesn't use anyone. The primary outcome for this study, it is the bone mineral disease that was measured by DEXA scan at two sites, the lumbar spine and femoral neck. We presented the bone mineral density in the result by using T-score and Z-score. We use Z-score for premenopausal women and men aged less than 50, and T-score for postmenopausal women, including premature menopause and men aged less than 50. As we say, the total number of participants in this study, 695. And the majority of our participants was female, about 90%, and median age was 53. As we say, we divided our participants into three main groups. PPI group about 180, famotidine 105, non-exposed 410. واحدة من أكبر المعضلات والليميتيشن اللي واجهتنا خلال الدراسة هاي إنه كيف في عندنا كثير comorbidity و risk factor it will be affected على bone mineral density. We should take in consideration during data collection and analysis. We collect more than 20 comorbidities and risk factor, and there was some significant between the group and some that was not significant. Significant difference across the group was found in DM, hypertension, cardiovascular disease, chronic liver disease, renal disease, and family history of osteoporosis and corticosteroid use, inflammatory disease. There was no significant difference in the gender, BMI, and several other comorbidities like cancer, chemotherapy, and smoking. This is the most important slide, and that would be answer the research question. Does use of the long protein pump inhibitor, it will cause osteoporosis? There was no significant association between long-term use of protein pump inhibitor and the risk of osteoporosis. Except there was one significant finding, it is the famotidine and non-exposed. Famotidine, it will increase the risk of osteoporosis in the patient that we use a T-score. This study has several limitations. As you say, this study it is a retrospective observational study. The second one, the predominance of female, which might limit the generalizability of our result to male patient. The third one, deposit adjustment of multiple confounder, residual confounding from the unmeasured variables such as physical activity and calcium intake might remain. The most participants have chronic illnesses, making the finding specific to patient common, encountering long-term protein pump inhibitor and less applicable to the healthy individual. Generalizability, result might not be generalized to the all Jordanian and the global health. بالأخص أن المale والhealthy individual. The finding most relevant to the patient have a chronic gastrointestinal and systematic disease. Future research using a prospective, multi-center, and population-based studies is needed to clarify the effect of long-term protein pump inhibitor and bone health in the wider population. The main conclusion for this slide, prolonged protein pump inhibitor use was not associated with significant reduce in bone mineral density at a femoral neck or lumbar spine when compared to the non-user or famotidine user. This is our team, and thank you for your attention. If you have any questions, please feel free to ask.